Hello everyone, Dr. here. I'm a board certified rheumatologist who practices integrative medicine in Hawaii. I also train medical students and resident doctors as a clinical professor. Today, we'll talk about core principles in creating healthy habits in patients. While this video is intended for my students, the framework I discuss can benefit anyone interested in creating healthy habits. In rheumatology, while treating autoimmune diseases, I realize often that medication alone is not enough to help my patient live a healthy life. As we know, factors like poor Western diet, obesity, sedentary lifestyle, and high stress are big contributors for chronic inflammation. It's not all genetics. I feel that as doctors, we do want to help them address these underlying factors for disease so that they can heal fundamentally. Like many of my patients, I personally struggled with chronic pain for 15 years. Traditional Western medicine alone couldn't provide the answers I needed. So after finishing my rheumatology fellowship, I went into an integrative medicine fellowship at the University of Arizona. I also learned from great teachers outside of academia, such as Tony Robbins, Dr. Joe Dispenza, Master Ko, and Mas Mike. I took coaching programs and hired coaches to help me coach other people. Basically, if I recommend a healthy diet to 20 people and only one person can do it, that means I suck at what I do. So I owned it. I analyzed my outcomes every 3 to 4 months and continuously upgraded them. My patients are doing way better clinically and on less medications than before I started this holistic approach. I want to share with you the big framework on how to create healthy habits for your patients. Here are the top 3 points. Number one, understand and appreciate their world. The thing is, this is not about you, this is about them. Patients themselves are the main characters in their story of their life, and you're their guide. If they feel that you don't appreciate or understand their world and push a certain approach on them, they're not going to listen. You need a rapport, a feeling of connection with another human being. I believe the fastest way to achieve rapport is to come from a place of, I love you and I'm here to serve you. Then all of their guard comes down. No need to express this verbally, but by having this thought in your mind, the intention is easily communicated through nonverbal communications. We need to know who this person is first. Who is she? She might be a mother, daughter, or grandmother to somebody. What is important to her in her life? What is this illness preventing her from doing or being? Understanding and appreciating their world is most important step in affecting other people. In order to change, in other words, get out of the comfort zone into new healthy habit to empower your healing process, you need two things. What and why. The patient needs to know clearly what they want to achieve. I often tell my patient to envision the best version of their life in 3 years if everything goes well perfectly in terms of health, finance, and relationships, and journal about it and bring to the appointment. Once we know clearly what they want to achieve, the next step is knowing why. Why do you want to feel better? Why do you want to heal from chronic illness? The stronger the why is, the more likely they will make it happen. For example, let's say there's a house on fire right in front of us. If there is $100 bill in there, I'm not going to go in for it. I'm not going to risk my life for $100 bill. But if my sister is trapped in that burning house, I'm going to break in and get her out no matter what. In my experience, the strongest why comes from love for others. So, what is the map and why is the fuel? Most people don't reach their desired destination because they don't really know what they want to achieve and they lack the fuel to overcome the temptation of the comfort zone. Not working out, sugary food, fatty food, they're all comfortable. We have to fight these temptations, you see. Another example, I have helped numerous patients quit smoking. You know, tobacco is one of the biggest risk factors for autoimmune disease. Particularly, I had this young mother who had severe dermatomyositis that required more and more medicine, and she wasn't doing well. We went through the process of implementing a healthy diet, exercise, mindfulness strategies, and tobacco cessation. She always felt tired from the autoimmune disease. She said, I want to be the best mother for my 2-year-old. She had a clear vision of what she wants to be and why. Love for her child. She lost weight and quit smoking. Her disease is in remission on the tiniest medicine possible. Once you have a strong what and why, the how shows up eventually with or without you. Since you're here, you can help patients with the how. I think the most important goal in this shared journey is to help them find their strong what and why. Point number 2, make it simple. There are so many complicated food pyramids out there, a lot of them make my eyes spin. When it comes to implementing a new habit, simplicity is power. In other words, complexity is the enemy of execution. What's the point of all this? Make them do things, right? For instance, we all know plant-rich diet is healthy. Rather than getting stuck in the details, make it simple for them. Lower the bar for execution. This is my version. Imagine a plate in front of you. 70% should be filled with vegetable. Vegetables are the main entree, and consider other types of food such as protein and starch as your side dish. Drink 60 to 80 ounces of water daily. Reduce ultra-processed foods such as ham, spam, sausage. Reduce refined sugar like soda, sugar-filled fruit juice. I tell them do the right thing 80% of the time and it will carry you to the right direction. Simple. My patients usually post a diagram on the refrigerator for reminders to use as a map. Usually, when one person is sick in the house from poor lifestyle, there's often chronic medical illness in other family members, such as their spouse. I have them get on the healthy lifestyle together. It's a teamwork. Point number 3, take care of yourself first. I think medicine is a way of sharing your love with the community. But where does love come from? It comes from within. When you're so depleted from tough schedules, too much work, your body and mind suffer. When you are depleted physically and mentally, it is hard to love other people. So take care of yourself first. Give your body and mind what they need in terms of nutritious food, rest, movement, meditation, connection with your loved ones in nature. Also, importantly, know that you're enough and lovable the way you are, no matter what other people say. Throughout my career, I have worked with many different leaders. Some leaders communicate with words only. It's like, I don't want to do this, but you should do it. Great leaders, though, communicate with their life. They communicate with their actions. If you smoke and tell your kids they should not smoke, what will they feel? They'll probably say, yeah, right, inside. I personally exercise every single day. I tell my patient I used to have chronic pain for 15 years. I eat healthy every day. I meditate every day. I exercise every day. I feel amazing. You should do it too. When I do them myself, my voice carries certainty to ignite something in them. Is it easy to go to yoga every night? No, it's not. But it's totally worth it, not just for myself, but for my patients. I want to be a great leader for my patients. But take care of yourself first, okay? Today, we discussed some core concept on building a healthy lifestyle for your patients. I hope you found it helpful. Thank you.